A very good afternoon to everyone. Today we'll be talking about thumb sucking. Actually, most commonly seen habit is thumb sucking. And thumb sucking or finger sucking habit seen in children from very small ages. It is defined as the placement of thumb of or one or more fingers in varying depth into the mouth. So this is how thumb sucking goes on, as you can see in the picture. This develops as a habit or due to sensitivity or sense of insecurity. There are many classifications proposed, out of which classification according to Subterry in 1973 is important. This classifies into group 1, 2, 3, and 4. Group 1 is placement of the thumb to the mouth beyond the first joint, and this occupies a large portion of the vault of the hard palate and pressing against the palate and areola mucosa. So as you can see in the picture here. Group 2, the thumb did not go completely into the vault area of the hard palate, however, usually entered into the mouth up to and around the first joint or anterior to it. So this is only a bit. Group 3, the thumb passed fully into the hard palate as in the group 1. And group 4 is that thumb did not progress appreciably into the mouth. The lower incisors made contact at the approximate level of the thumbnail. So this is how group 4 will be. So this is the classification by subtechnique. Now there is a lot of etiological factors which plays major roles behind this formation of the or development of the habit. The first one is the Freudian theory. It is proposed by Sigmund Freud, which suggests that the child passes through various stages of psychological development, which the oral and anal phases are seen in the first 3 years of the life. So in the oral phase, the mouth is believed to be an oroerotic zone. This child has a tendency to place fingers or any other object into the oral cavity, which is placed next to the cheeks and all. So they have whatever they get, they have a habit of placing it inside their oral cavity. So that is by the Freudian psychological theory. Now, prevention of such an act is believed to be result in emotional insecurity and poses the risk of child indulging into other habits. Next theory is oral drive theory by Sears and Weiss. This is proposed that prolonged sucking, which can lead to thumb sucking with no underlying cause of psychological variant. Another one is Benjamin's theory. Benjamin suggested that thumb sucking arises from rooting reflex. Rooting reflex means the movement of the infant's head and tongue towards the object which is touching the cheek. So something is touching the cheek, the baby or the mammal or infant feels to turn towards that and they start sucking it. So that is a rooting reflex. The object is usually the mother's breast or maybe also finger or pacifier. This rooting reflex disappears in normal infants around 7 to 8 months of age. Learning theory by Davidson. According to this theory, habit stems from an adaptive response and assumes no underlying psychological cause. It is acquired as a result of learning. Other factors which plays major role in the etiology are parents' occupation, working mother, number of siblings, and social adjustment and stress. Now, how can we diagnose? The major part of the diagnosis is derived from history, which says psychological component, habit triad, that is frequency, intensity, and duration of the habit, inquiry about the feeding pattern, parental care, other presence of other habits, all those things. And diagnosis can be obvious when the child is actively performing the habit. However, during a dental appointment, child may seldom indulge into the habit. Extraoral examination into the digit, as we can experience or see the digit, which will be appear reddened, exceptionally clean and very neat and sharp. And there is a formation of dishpan finger, that is due to the continuous suckling that can go into a shape of the dishpan. In the lips, there will be open mouth posture, or sometimes because of the proclination of the anteriors, it can have a proclined appearance. Facial form, mandibular retrognathison can be seen, maxillary prognathism or protrusion can be seen. And when the patient is swallowing, it is observed that presence of facial grimace or an excessive mentalis muscle contraction can be experienced here. And facial profile is either convex or flat. In the intraoral examination, see, when there is suckling development, the thumb will be placed inside the oral cavity and there is a suckling kind of action developing, right? So when there is suckling action, the buccinator muscle plays a major role and the buccinator pulls inside, so there will be an extra force and the neutral zone is disturbed. So hence, this causes the malelement of heat. How? because this masseter is pulled inside, it creates a force, extra force. So the pulling of the muscle is done, and hence the maxillary arch goes for constriction, and hence develops the crossbite in the posterior region. So that crossbite can be seen. As well as one more thing is prominent, that is placement of thumb is usually there inside the mouth. So there is development of open bite in the anterior region. So this is how you can see the habit, and upper anterior proclination and lower anterior reclination also can be seen.